Welcome back to Medical's Academy, your trusted career mentor. In today's video, we'll take you right into the forest. Picture this. You're out camping, enjoying nature, when suddenly you get injured by a sharp tree branch. What should you do next? Stick with us as we walk you through simple, life-saving first aid steps you can take immediately, even with limited supplies. By the end of this video, you'll know exactly how to stay safe, prevent infection, and decide when it's time to seek medical help. Let's get started. Imagine you're out camping, enjoying nature, when suddenly you trip or brush against a sharp tree branch and it cuts into your skin. The first thing to do is stay calm. Panicking can make bleeding worse and cloud your judgment. Take a deep breath. Stop moving and quickly assess the situation. Ask yourself, is the wound deep? Is it bleeding heavily? Or is it just a small scratch? This will guide your next steps. Next, make sure you're in a safe spot, away from other branches, rocks, or hazards. If the wound is bleeding, apply direct pressure with a clean cloth, bandana, or even your shirt. Hold steady pressure for several minutes. Most small cuts will stop bleeding with this alone. If blood is spurting or soaking through quickly, keep pressing firmly and elevate the injured part if possible. Once bleeding is under control, the next step is to clean the wound. Out in the forest, your biggest risk is infection. Use clean water from your bottle, or if you have, sterile saline from a first aid kit. Rinse the wound thoroughly to remove dirt, bark, or debris. Avoid using unfiltered river or lake water unless it's an emergency, as it can introduce bacteria. If you see small pieces of wood or dirt, gently remove them with clean hands or sterilized tweezers. After cleaning, gently pat the area dry with a clean cloth. Apply an antiseptic if you have one, like iodine or alcohol wipes. Then cover the wound with a sterile dressing or bandage. This keeps dirt out and helps healing. If the wound is small, a plaster or adhesive bandage may be enough. If it's bigger, improvise with clean fabric secured with tape or strips of clothing. Remember, keeping the wound covered is key when you're outdoors. Now keep an eye on your injury. If the bleeding doesn't stop, the wound is very deep. Or if you suspect the branch was dirty, you need medical attention as soon as possible. Watch for signs of infection in the coming days. Redness, swelling, pus, or fever. Also, think about your tetanus vaccination status. Tree branch injuries can put you at risk, and if you're not up to date, you'll need a booster. If you're far from help, clean and redress the wound regularly and make your way back to medical care. So remember, stay calm, stop the bleeding, clean the wound, cover it, and seek help if needed. These simple steps can make a huge difference when you're out in the wild. Welcome back to Medical's Academy,